For this presentation, I'm going to talk to you about a condition known as Osgood Schlatters Disease. Now, this was named in 1903 by Robert Osgood and Carl Schlatter, so they coined the term then. So it's been, it's quite an old condition. But naturally, when the 13-year-old boy that plays football complains to his parents, oh, my knee hurts, or this part of the knee hurts, it's not really the knee in itself, it's the tibial tubercle on the tibia, so this bump along here. And then naturally you can see this extra bit of bump forming along here. Okay, so that would be like an Osgood Schlatter. But basically, another term is what we call a traction apophysitis. So this, where the ligamentum patelli, you can call it the patellar tendon here, from the sesamoid of the patella comes down to this area, where the boy, if you like, is kicking, and obviously girls as well, because a lot more girls are playing football. So where they extend the leg, it's causing like a reaction around here. So it's called the apophysis. The shaft of the bone is diaphysis. Where it grows from is the epiphysis, and you end up with the epiphyseal plate. And naturally on the teenager, it's still in the growth phase. And you've also got an area within the bone called the metaphysis, where the marrow is stored. But for this talk, it's just simply about the apophysis. So where it's irritated, it attaches to the periosteum, which is like a sheet of cling film around the bone. And then within the periosteum, you naturally have like a blood supply. But you've also got bone forming cells where you have these bone, we call it the osteoblasts, where they lay down new bone to this sort of area. So if you irritate the bone enough, then it's going to send new bone cells to that area. In extreme, it can actually affect the way the growth plate grows on the lateral of the femoral condyle. And if they suspect that, then they typically put the teenager in like a full plaster Paris to stop activity from that sort of area. So it's normally on the teenager, where it forms around here. They end up like with a bump. They can do treatment for, where they use like a strap around in this area. But sometimes what the parent might not realize is that, the teenager is not just playing football maybe on a Tuesday evening and maybe the odd Saturday game. As soon as they go to school, they're kicking a football on a hard surface with hard trainers or hard shoes, that sort of thing. Break time, they are kicking the ball. Lunchtime, etc., etc. So it's constant. So sometimes it's not so much educating the child about the condition, it's sometimes you almost have to educate the parents about trying, because in extreme, they could be put in a plaster Paris. By the time that teenager is grown past that phase, as they hit in like 17, 18, 19, etc., then obviously the growth plates have fully formed, then the chances of having it is quite slim.